This is going to be about how to use a stretchy wrap, sort of one of a basic type of carrier, especially for newborns. Can be used up to a higher weight. Most people would find about 15 to 20 pounds is when they stop being so comfortable. So it's definitely a favorite for newborns, and then most people will switch to another type once their baby gets a little bit heavier. One of the reasons people like them for newborns is because they're nice and soft, and they're nice and cuddly. The nice thing about stretchy wraps too is that you don't usually need to adjust them, so you can often put them on and then leave them on and take the baby in and out as many times as you need, which is pretty handy, especially if you're going to be wearing your baby a lot. So I'll just show you the sort of basic hold, the basic wrap for all stretchy wraps. So you're going to look for your middle marker. Most of them will have some sort of a middle marker or a panel that you can just kind of estimate where the middle is. And you're going to put that across your front with the middle sort of right in between. Okay, and then what you're going to do is take one side and spread it out. And you want to have it nicely spread because that's going to give you your supports. That's your weight distribution. If you've got it all bunched up, you're going to notice the strain a lot sooner. So have it spread as much as you can and over the opposite shoulder. And do the same thing with the other piece. Spread it up over the shoulder. Okay. And you want to have it fairly snug, depending on the size of your baby, of course. If I had a little 5-pound baby I'm putting in here, I'm going to have it very, very snug. If my baby's 12 pounds, 13 pounds, I'm going to be leaving a little bit of space because they only stretch so far. This one's not super, super stretchy, so I'm leaving just a little bit of room here. Okay, and then you want to cross them over again. Now, I have heard from some sources that the best way to cross them is the same way that you cross them in the back. So I came up this shoulder first, so this is my inner one at the back. So ideally, I'd make that one my inner one at the front. Okay, so I'm just crossing them over again. And then I'm going around, and I can either tie the back or the front, just depending on how much fabric you have left over. I'm going to tie this in the front. Okay. And I think I'm just going to tighten this up a little bit. And you can adjust this a little bit once your baby's in, but the more adjusting you do beforehand, the easier it's going to be. Okay. So I'm going to pull this panel, the first one I did across, down. I'm just going to work with these two crosses for now. You're going to take your baby. Now there's a number of different ways that you can put them in for legs in, legs out options. So when they're really little, I probably want their legs in. So you're going to take your inside pocket, put them in there, and you just kind of just fold their legs up in sort of what is a natural position. So if you're holding your baby on you without a carrier, they bring their knees up. Often their legs will cross at the ankle. So that's kind of how you want to have them in there. That's going to be the most comfortable for them. Okay, and then you're going to spread out this panel and spread out the outer panel. And then the other one that we pushed down before just comes up behind. Now this looks very loose. If this was a real baby, I would have it much tighter, but this is not really the size of most real babies. Okay, so this is just baby. So this is just adding extra support. You can, you could leave it down if it was a hotter day and didn't want as much fabric. You can certainly do that. But especially for real newborns who don't have much head control, it's nice to have this up here behind their head to really keep them secure. You always want to make sure when you're in here they're nice and close to you. You should be able to kiss them easily without having to lift them up. shouldn't feel any pulling or sagging from the wrap. If you do, tighten it up. And this is where, if I needed to tighten it, I can just yank it around here. And I'm sort of tightening everything. I'm going to do that. Okay, and then tie. In this position, fairly easy to nurse. You may have to pull this panel down, and then you can sort of shift them over. So they're in that inner panel, right? So you can put their feet, you might need to put their feet sort of to the side here. You can still pull that up, pull this one back over, just pull this down a little bit. Okay, and then you can cradle their head and latch them on that way. Okay, I don't recommend carrying them in a cradle position for long periods of time, or if they're not nursing, just because it's easier to block their airway this way. It's advisable to have them upright most of the time, but for nursing that is a good position, and then you can just slide them back over. Okay, and reset all your panels. And the other option for when they're a little bit bigger is to have their legs out. Okay, so they'd be like this. Now you want to make sure that both of your crosses are spread to your baby's knees. And that's going to support them in a proper seated position. Their knees should be higher than their bum, so that they're sitting with their legs bent at the hip and at the knee. This baby's obviously not going to do that, but that's how you want it for the baby. And then again, you can pull this up. And in this case, you could potentially just leave their feet inside, but most people have their feet at the bottom. So it's just like that. And again, the more support they need, the higher you can bring that up. Again, she's up nice and high, so I can make sure that her airway isn't blocked. Alright, so those are sort of the basic two positions. Once they get a little bit older and want their arms out, you certainly can do that, just like this. And again, your outer panel is providing that support for them. Probably wouldn't do this until they're sort of more steady and able to sit with support. Alright. Back carries, not a good idea with the stretchy wrap. The main reason is because there is that stretch, and when they're on your back, should they choose to flip out, there's not a lot you can do to stop them. So back carries are not recommended for stretchy wraps. You want to get either a woven wrap or another type of carrier that can facilitate a back carry safely. To get your baby out, you're basically just undoing everything. So pulling down that panel, and this one, and the baby out this way, and then they're out. So again, because this is stretchy, it hasn't really moved a whole lot. I could just leave this on, and the next time I need to put baby in, it's already tied. Or if I do need to untie it and put it away, then that's easy enough to do too. One of the complaints I've heard of wraps is that they take a long time. I find, especially with a stretchy wrap, it's one way to tie it. You certainly can tie it other ways, but if you want to only learn the one, that's it, and it's not that complicated. And once you know how to do it, the more you practice it, the faster you get. I'm pretty quick at it now. I can get it on and get my baby in probably a minute or less. So it's really not that much of a hassle at all, and certainly a nice, comfortable, cozy carrier to use.